cause of death and disability. The state from which we come from tops all the Indian states for diabetes, hypertension, and then we've seen that these patients start at a very young age. So what we decided to do was we decided to screen the patients who come to the comprehensive health clinic, which is a voluntary health checkup clinic where they come to, and we use the modified steps WHO steps protocol or questionnaire to assess their baseline characteristics and demographics. And we also set up a multidisciplinary team, including the physician, a social worker, a dietitian, a physical therapist, and the nurse educator to interact with that team and come to the initial assessment, the basis of which we got our data, and subsequent to that now we are in the process of determining the interventions so that we hope to follow these patients over a period of the next 10 years so as to develop a registry and understand how these people do with the interventions and how many how many of these patients accept these interventions and those who don't. So what we saw actually was the baseline characteristics where the patients came from a pretty educated section. 70% of the patients were educated. They held white-collar jobs, and they were not, current smokers were quite few. Alcohol, 30% of the patients did drink alcohol. Intake of fruits and vegetables, and which as per the WHO characteristics of 5 servings per day, was quite significantly low. Most people ate outside. The body mass index wise too, we did find a significant, more than 50% of the population was overweight or obese. And this is all the young working class. So this was a major area which we thought was significant for intervention. Physical activity level was also quite, about 40% plus had a very low physical activity level, much in contrast to Sweden as we understand now. So these were the baseline characteristics and the incidence of non-communicable diseases. We saw hypertension, diabetes. About 30% of these patients with the risk factors correlated with the non-communicable diseases. And the most important thing which we feel is there was no risk stratification score for the Indian subcontinent. So we used the atherosclerotic cerebrovascular disease risk score, which has accounted for South Asian population. And what we found was the patients who did not seemingly have a low 10-year risk, or who did have a low 10-year risk, had a pretty significant lifetime risk of developing a cardiovascular event. So almost 70% of the patients who had a pretty low risk, low 10-year risk, did have a high risk. So this was what we tried to reinforce the patients so that we could get them to use the interventions, and we intend to use this as a parameter to follow them over the timeline.